Hi, I'm here with Karen Hargrave, who's one of the founders of the There for Emmy campaign. Karen, thanks for joining me. I'm curious just about how the campaign came about, and what the timeline of that was, and what you've been doing, what you see as the goals of the campaign. So why don't you just tell us first how you came about to start it?
Yeah, I'll give you the long version of the story. So, I mean, it came very much from personal experience. So I talked to lots of people about my story now, but basically, both myself and my husband developed ME after COVID infection, sort of connected to long COVID. So I got sick right at the beginning of the pandemic back in March 2020. Sort of, yeah, it was pretty severe, moderate severe ME, I guess, looking back, for a couple of years. Was kind of really, yeah, had to take a lot of time off work, was really struggling for quite a while.
Did you know about ME before you had
I
long COVID?
didn't. I think I'd heard about people having ME, but I knew very little about it. And it was kind of, so I feel like I've kind of gone on this learning journey in the last 4 years. So I developed these symptoms after I had COVID. It's the kind of classic story. I just sort of didn't recover, was getting these sort of, the work I do, a lot of it is kind of reading and writing, and I was really struggling with these sort of cognitive symptoms. And I think at some point people sort of, because it was right at the beginning, to start with, I had no idea what was going on. And then people started talking about long COVID. I sort of started seeing support groups popping up. So I kind of started to think, okay, so this is what it is. There's this long COVID thing. And at some point, I just read something online about ME. And I just had this sort of light bulb moment of thinking, "Oh, these are exactly my symptoms, kind of feeling terrible after exertion, just, going to
Right.
that down the list of ME symptoms, thinking wait a minute, this is what it is, and why is no one talking about people, within the sort of long COVID community, why aren't people talking more about ME? And naively, I think I also had this feeling of thinking, great, I've got it's not just this new disease that's come from COVID. I've got, ME is a thing. There's an NHS web page on it. I'm sure there's a treatment pathway. It's a sort of, a
Mhm.
diagnosis that I can pursue. So I kind of naively thought that that would be a great thing to have ME diagnosis. So I kind of really pursued that because I sort of felt that my symptoms sort of fit that category. And I guess I had the kind of experience over the period of a couple of years of just sort of having that kind of creeping realization that that I could, I think for a long time I just thought it was a case of finding the right doctor, getting the right referral, seeing the right person, and finally I'd get the help that I was looking for. And I just had this kind of creeping realization that, I got an ME diagnosis and I got referred, but the more I learned, the more I sort of started to realize that there was nothing there, that there wasn't any treatment that was really available. And I guess my background is as a researcher. A lot of the work I do is research work. So I'm kind of always quite
What kind
curious.
of research?
I work in the humanitarian sector. So my kind of area of sort of expertise, quote unquote, is migration and refugee policy.
Mhm.
But I kind of work generally in the humanitarian sector, and I do kind of a lot. I'm doing a lot on the war in Ukraine. So quite a different area. But I guess I've got a sort of researchy brain, and I like to learn and I like to read about things. So I kind of started just reading more and more about ME, and just I guess a lot of people have had this experience of the more you read about it, the more horrifying it is. You just kind of start thinking, well,
Right.
how can there be this group of people that's so big that are suffering so much, who've been mistreated for so long, and I had absolutely no idea this was happening. How has that happened? So I kind of had that. I guess I went on that sort of learning journey. And yeah, I mean, I've always really loved the NHS. So, lots of people were saying to me, well, why don't you try private healthcare? Why don't you try? And I was just saying, no, like I just need to wait. I just need to get to the end of the waiting list. Like the NHS will be able to help me eventually. So it was a real kind of disillusioning, I guess, experience of sort of healthcare in this country. And yeah, I mean, I didn't really, I kind of, I got the class. I was seen in an ME clinic. It was an ME clinic that was treating people with long COVID as well. And I had the kind of classic 10-week course on Zoom on how to manage your energy. And then that was kind of it. And I guess none of that really helped me, but I did have a pretty dramatic recovery. Not a full recovery, but my symptoms improved a lot. Probably about two and a
You
half
sort of would be in partial remission, you would say now. Would that be?
Yeah, I still have to be very careful. So I take rests a few times a day. I have to be really, really careful. I mean, I'm juggling a crazy amount at the moment, but I have to be careful not to overdo it. If I do too much, I do get post-exertional malaise still. So I still count myself as kind of having ME, but these days it's pretty mild and it's very manageable. I
So
think
you realized there was this situation, and your husband also was sick at the same time.
So he got sick later. So it was kind of the strange thing where we had COVID the first time. He was completely fine. I got sick, and then pretty much as I was recovering, we had COVID a second time, and I was fine as the second time, but James then, yeah, he got sick afterwards, and yeah, he deteriorated really, really rapidly throughout the course of last year. To the point that he kind of, yeah, was eventually diagnosed with very severe ME. It was a pretty rapid deterioration. And I guess I mean, it was horrifying going through it all again and sort of watching the person that I love most go through what I just, just been through. But it was also just, I guess it was like the experience I'd just had on steroids, right? Because he was so much sicker than I think at my worst, I was probably dipping into severe. I was bedbound. I was kind of not able to do very much. But, James, he's kind of at the point where he's completely reliant on full-time care, completely bedbound, has difficulties swallowing. And I guess to have this experience of James being so incredibly ill, and there being no help available, essentially. So, I mean, we did eventually go, like most of people with very severe ME, we sort of ended up seeing someone privately,
Mhm.
um, just to get some kind of help and talk to someone who understood. But I think I mean, I guess there was this very difficult personal experience of trying to access healthcare. And I've had sort of plenty of, experiences of myself of being dismissed, not being believed, told that I just need to go for a walk, get out to the shop, see if I feel better, So I had all of these
You had
experiences.
those experiences of being told that
Yeah, the first time I went to my GP, they said maybe you're just a bit depressed, maybe you need to get out to the shops, maybe you need to try, like go for a walk and see if you feel better. I've kind of had all of that. I was diagnosed at one point with FND,
you
when
were.
well, I had symptoms where I sort of had weakness down one side of my body that I still get, that I think now, years later, I think are probably connected to like migraines. But it was, I mean, had an MRI, came back clear, and then sort of dismissed back to, I think the words the neurologist used was, why don't we draw a line under it then? And
I'm sorry,
yeah,
say it again. I didn't hear that.
why don't we just draw a line under it then? And he sent me back to the GP with a, basically, we don't know what's going on, silly hysterical woman kind of.
So with all this frustration, how did the campaign come about?
Yeah, so basically I've been wanting to do something advocacy wise around ME and or long COVID for quite a long time. I kind of, my background is, so I mentioned I do research work, but the research work I've done, it's all kind of policy relevant research, and it's always been kind of, all of my work has been sort of aimed at influencing policy, and I've done kind of advocacy and sort of some public affairs type roles in the past. So I kind of wanted to do some advocacy work around this for a really, really long time. But first of all, I was too sick. And then with James, I just had far too much going on to be able to get the headspace to think about it. And it was basically earlier this year, sort of springtime, things started to be a bit settled. And around then I met Emma, who I co-founded the campaign with. We met online, and I can't believe I've only known her since May, but it feels like it's been a lifetime. We talk pretty much every day. So she cares for a partner who's also called James, who also has very severe ME and from long COVID and has had a very similar experience. And we kind of developed this friendship very quickly because I think going through the experience of being a carer to someone with very severe ME who's also your partner it can be quite a specific experience because you're going through this, you know, very difficult thing of having to suddenly become a full-time carer. But you know, the person that you most want to talk to about it and
Right.
rely on for support, you know, I can't have a conversation with. You know, I can barely send messages to. So I think we were having the very similar experience, and we found each other and we were able to kind of really support each other. I always joke and say that I have all the kind of, you know, all the stupid things during the day that usually, you know, I used to message James about like stupid stuff that happened that no one cares about. And I'll send them to Emma most of the time. And she does the same because I think we both kind of lost, well, you know, both our partners, they're still there, but the kind of relationship we have with them has changed fundamentally because of how sick they are. So there's something that, yeah, I guess a loss that we've both been going through. So we met in May, I think. We became very close friends. And I think at some point I kind of mentioned I've been thinking for ages I wanted to do some advocacy around this. And I think we just realized very quickly that we were on a very, very similar wavelength about it. You know, we were both completely outraged at the lack of care that was available. You know, we both had these through our partners and through my own experiences with long COVID, but we'd both made the connection with Emmy as well. And we were thinking, why is no one really bringing the two together so much? And so we just ended up launching into it without really knowing what we wanted it to be. We just kind of thought, let's give it a go and see what happens. But
And so you launched it in the summer.
yeah, we launched it in the summer and I mean, I don't think we were expecting it to pick up as quickly as it did. I think
Do you think that I mean, it sort of was around the time of Maeve Boothby O'Neill's
yeah,
inquest. And
yeah.
so did that attention, which was getting a lot of media attention, and also the cases of other severe cases that have come up in NHS hospitals or connected to NHS hospitals, did that publicity around that sort of spur some of the momentum for the campaign?
I think, yeah, I mean, I think undoubtedly it helped. And I think I guess it was a way for the media to, I guess, broaden the conversation out a little bit, to talking, I guess, not just about the one case and what Maeve and her family went through, but to be making the connection to, you know, other people who are going through something similar. And I guess, you know, I think in a lot of ways, I think there was a particular moment in terms of the media attention, and it just so, you know, it was a complete coincidence, but it just so happened that was kind of around when we were launching the campaign. So then we kind of did a couple of interviews and sort of more interviews came from that. And yeah, it really took off very, very quickly and grew a lot quicker than we were
Why
expecting
don't you
it
tell
to.
us what the campaign is exactly? Like, what are the components of it? What does it consist of? I guess you started with an appeal or with a letter or petition, kind of. Was that the first?
Yeah, so we did a survey. So this again going back to my research background, but I was trying to think where do we even start, and I thought, okay, let's start with some evidence. Let's start with a survey. So we did a survey. I think it would have been back in June, and we had over 300 people. Around then, I kind of reached out to various organisations who helped to share it and gathered experiences from people with ME and people with long COVID. Particularly around because we kind of knew at that point there was almost definitely going to be a Labour government. So we sort of surveyed people around what they thought about specific parts of Labour's plans for the NHS and how that might relate to ME and long COVID. So the first thing we did was publish a report, and there was an open letter to the Secretary of State, which was we had I think it was 2,600 patients and carers signed it in the end, which was, yeah, incredible. And we
And
also,
in July, that was when?
sorry, what was that?
When was that? When was that?
That was I think the letter was in July, and I remember Emma saying she'll still say she like couldn't see past. She was like, we're going to publish the report and then we're going to do the open letter, and she was like, she couldn't see what past that. And then we published the letter, and she was like, oh wait, and now there's still a campaign to do. But we sent the letter, and then we did a lot of media around then, and we sent a second letter, which was from healthcare workers in September for Patient Safety Day, which was signed by over 200 healthcare workers, and that was kind of particularly focused on sort of severe ME and patient safety issues, and again to the Secretary of State for Health and Social Care, Wes Streeting.
And that was signed up by that was signed by healthcare providers. Is that
Yeah. So
correct?
we had a lot of, I think it was over 50 consultants, lots of GPs, nurses, basically healthcare workers who were saying seeing the same issues as us. And I think, I think that was really a really important moment for us, because I think it was really important for us to be making the point that we weren't just talking about patients being failed by the system, but that healthcare workers were being failed pretty much as badly, because they don't have the education, they don't have the institutional structures. So if someone with very severe ME turns up in your hospital, they don't have a lot of resources to draw on. It might be the first person with very severe ME that they've seen in their career. They haven't had the training. If they were trained on ME, chronic fatigue, they were possibly told that they was trained around the biopsychosocial model. So I think it was quite important in, I guess we were trying to broaden out the base of support for the campaign as well. So rather than sort of, I think often there can be a sense of it being kind of patients versus healthcare workers. And I think we wanted to make it really clear that actually a lot of us are all on the same page. And there's a lot of healthcare workers, including people who developed ME, many from COVID, from the pandemic, who are just as concerned as we are about the situation.
So where is the campaign now? I mean, what's happening with it? You got it off the ground in the summer. You had these letters. Where are things now?
So I guess we're trying to we did quite a bit. We also did quite a bit in Parliament last month. So I guess we're kind of working now. We've been taking a bit of a step back and trying to think a bit more strategically about what we're trying to do and what we're trying to achieve and who we need to be talking to and what we need to be doing to reach them. So we've been trying to, I guess, expand our networks, and last month we were particularly focusing in Parliament. So we sent a letter. I think in the end it was signed by, I should get this right, 28 or 29. I think it was 28 organisations and smaller initiatives to the House of Commons Health and Social Care Select Committee, and we're sort of asking for an inquiry into the sort of historic approaches to ME and infection-associated chronic conditions, and how that has affected care today for both people with ME, but also with long COVID. And I guess what we're trying to do, we're still focusing on sort of trying to influence ministers and government approaches, but I think we've kind of felt that we're not getting the response that we want, or we're not getting a huge amount back. And I think that's where Parliament can play a really, really important role in sort of providing that scrutiny. So we've been kind of working, particularly in Parliament, to try and expand our networks, to identify MPs or peers who might be supportive and who might be able to kind of help us use the different levers that we have in Parliament to sort of put a little bit of pressure on the government to be doing sort of more and faster. Because I think the issue that we're finding is, I think, just the lack of urgency in all of this. Like, I'm sure, David, you'll know about the cross-government plan for ME that was commissioned well over 2 years ago now, right? Like, that's an extraordinary length of time. It still hasn't, we still haven't seen the results from the consultation, let alone the delivery plan. And if you're someone who has severe ME, or you're caring for someone with very severe ME, just the urgency is incredible, because every day I'm thinking, is James going to be able to swallow enough to get the nutrition he needs? Are we going to end up in hospital? It's just, what we want is our life back, right? We want our life back, and we want to know that if we go into a hospital or we go to get medical treatment, that the care will be safe. And that's as a patient or a carer, that feels incredibly, incredibly urgent. And I think that's not what we're not seeing at the moment from the government side. So we're trying to see what we can do in Parliament to kind of increase that pressure.
So why don't you tell us where the government plan is? Like what's the status of that at this point?
Well, we've had a few questions in Parliament, so it's always it's a little bit like what's the word, criminology, trying to read between the lines from the kind of official responses to what it means. I think we're basically, I think the two steps from what I understand that are left are there was a consultation that happened last year. The first step is publishing the results from that consultation, and then once the consultation is published, then afterwards they will publish the plan. They keep saying that they'll publish the consultation results in the autumn. It's I don't know how far you can stretch autumn. I feel like once you get past November,
Right.
autumn's sort of coming to an end, but hopefully that will be soon. The delivery plan is kind of slated. They've sort of said winter 24-25. Winter again, you can probably stretch to kind of February next year. So I guess hopefully within the next 6 months, we will have the consultation and the plan. But there doesn't seem to have been a lot of urgency. And I guess, of course, as well, getting publishing the plan, that's the first step, right? But it's just a piece of paper. And there's so much that would need to happen after that to actually change care and to implement whatever ends up being in that plan. I think we need to get that first step out of the way, basically.
Do you have a sense that with all the publicity that there has at least been a shift in awareness of, that there's a gap in here that needs to be addressed, or a gap in awareness at least that needs to be addressed? Is that something that is happening, do you think?
Yeah, so I think the public conversation is, I think it has shifted and it's changing a little bit. I think all the media around the inquest in the summer helped. I think there's just a lot of people who had no idea, like me 5 years ago, I had absolutely no idea that this was happening to people with ME. And there's a lot of people who genuinely have no idea when you explain it to them. And that includes, I've spoken to a lot of journalists, a lot of TV, radio producers who you'll explain it to them and they'll say, oh my God, I didn't realize ME could be this bad. I didn't realize there wasn't any care available. So I think, obviously, I think there's a really big public education piece that needs to be done. I think that's important because people with ME live in society, right? And it matters that if the people around you understand the disease that you have, because if they don't, it matters if your employer understands that you have a serious disease and it's not just you being a little bit lazy and not wanting to go back to work. It matters if your friends or your family understand that this is a kind of biomedical illness and not something that's psychosomatic. So I think the kind of public education piece matters for that. And I think it also matters because obviously governments respond to public pressure. And if something, if people are talking about something, if it's in the media a lot, that creates pressure to act. I think often, I guess this is something I've seen from the sort of work I've done in my professional life. Often governments won't act until they can't not, until they really have to, until it's kind of easier to take action than to do anything else. So I think trying to create public pressure and scrutiny around it is really, really important.
One of the challenging things is the public pressure for what? Since we don't really know what exactly are the causes, I mean, it's still all being, worked out. We don't really know what treatments should be. So it's all great to say government should do more, but the question is, do more what, to some
So,
degree?
yeah, so we've kind of been refining that. That's part of the sort of stepping back. So I mean the number one, the first thing we're talking about is safe care, because I think that is something that we can do now. So, basically by that we mean that the NHS should be saving people's lives with ME if they end up in hospital, and the NHS, people shouldn't be getting worse as a result of NHS care. That means things like not prescribing graded exercise. And I think we can provide as a baseline, based on what we know already, I think we have the tools to provide care that is as a baseline safe. So that's sort of the first thing that we're
So the
asking for. And
baseline is essentially don't recommend harmful treatments.
well, exactly, and it's a terrifying thing to have to be arguing for that, right? Like, don't recommend harmful treatment. Make sure that care is accessible to people with ME. You know, make sure if someone who has ME has a heart attack, that they're going to be able to get medical care for that within, you know, they're not going to think, well, I can't go into hospital because I can't manage the, you know, the exertion that's involved. And make sure if someone with very severe ends up in hospital, that you give them the right feeding tube and they don't starve to death. You know, these are very basic things. And we're trying to talk about that as a patient safety issue because that is something that this government has, you know, it was one of their manifesto commitments. They talk about patient safety. And again, it I think we're trying to reframe it, you know, again, this isn't just patients being difficult. We're asking for something very basic. We're just asking for care that is safe, that's not going to make people worse, and that we're going to use the tools that we have to save people's lives. But I guess I think we feel that if nothing else, hopefully we can generate consensus and support for that. I think the more complicated piece that we're starting to think about now is also around what can be done to kind of accelerate research, accelerate treatments. You know, effectively, if you look at the funding that has gone into ME research in the UK, it's, you know, compared to other diseases, it's tiny. We were kind of looking at it. There was some
And so
recent
much
figures.
of it is spent on variations of CBT and graded exercise therapy in person, online, in groups. I mean, so much money has been spent on these treatments, investigating these treatments in all
Yeah,
sorts of different slices and, ways.
yeah. Well, I mean, we're not even spending the money that has gone in, the pittance that's gone in has been spent very poorly. And I think, and unfortunately, that's been replicated with long COVID research. So 50 million pounds went into long COVID research at the beginning of the pandemic, and we did see a lot of these kind of, you know, biopsychosocial pieces
Yes,
of
yes.
research looking
And
at
I've written
behavioral
about some of those.
treatment. Yeah, exactly. That were replicated. And I think we didn't take on board the lessons of what we've learned from ME research and apply that to long COVID. So a lot of that money was effectively wasted on stuff that probably wasn't worth the research funding. So I think, you know, I think getting research funding going into it is really important. And I think, you know, also looking at what can be done to increase access to kind of more emerging treatments in the NHS, you know, in the same way that people with, you know, different kinds of cancer who have very low qualities of life may be able to access experimental treatments or, you know, have access to clinical trials and all of that. For ME, there's none of that, right? There's just a blanket, all we can give you is pacing advice. If they're not following the nice guidelines, they'll tell you to pace up or whatever whatever it's called now. And there's just, I mean, I think that like the most damning indictment is that I went through the NHS myself for ME, and we decided not to bother with James because we just thought, based on what I've received, there's 0 point, there's nothing that he's going to receive that's going to be of any benefit to him at all. It's only just going to be a drain on our time and our very, very limited energy to go through that. So we just didn't bother asking for a referral to ME services. So I think I think that in a way, I think it's really daunting when we think about it as a campaign because there's so much that needs to change. You know, people aren't even receiving, like we're saying, the basics of safe care. And it's such a long way from where we are to people, you know, receiving meaningful treatment that's able to help them to manage their symptoms, maybe be able to get back in some ways to the lives they had before. But I try and be an optimist where I can. And I think on the flip side, it means that the low-hanging fruit are still there, right? Like all of the low-hanging fruit are there. You know, there's there's simple things that can be done, like looking at access to clinical trials, like giving people, you know, people with very severe ME feeding tubes when they're starving to death. That can be done. That would massively improve the patient experience. So, you know, why not start with the low-hanging fruit? Let's get those done. And then seeing what can be done to kind of
Right.
build a
Just
change.
not first making sure people don't die in the hospital
But
or
yeah, and
you know,
that's the baseline, and that's something that should not be happening. today in 2024. And we know how to stop someone starving to death. And I think there are big questions, you know, well, there's the obvious questions, right, about how we've ended up in the situation that we're in. And I think there's both, I guess we're trying to inject both a sense of injustice and outrage at how badly people are being treated, but also some kind of hope that it can get better and that change is possible. Because I think that sense of hope, we've had a lot of people write to us. We're a very small team. There's just three of us in our campaign. It's me and Emma, and a few weeks in, by chance we just brought in Una Cousins, who
Right.
has been involved with long COVID advocacy. We just had a conversation, and I was like, "Oh, Una's great. Let's bring her in." And now we're kind of
Yeah,
small
she's the
little.
rower. She's just to clarify, Una Cousins is the Olympic equality rower who got long COVID and couldn't participate in the Olympics. Well,
Yeah, and she's now retired from professional sport and she's been working on long COVID advocacy, and she's now part of our
well,
campaign.
it seems like you definitely all have your work cut out for you. But it does seem like it's sort of gotten off to some good momentum as a start. So thank you,
Yeah,
Karen.
thank you.
I appreciate your time.
Yeah, and we've got some exciting stuff coming up. I can't tell you exactly what yet, but watch this space.
But we'll look forward to that. Okay.